All right, don't want you getting blocked by our poster board here. Well, thank you very much, everybody, for coming here this afternoon, again, for another one of our updates for how the state is combating the spread of coronavirus here in Nebraska. And you may see that we've got some new poster boards up here. This is a slogan that we want to continue to, or we'll get to out there and promote. Stay home, stay healthy, stay connected. And it gets back to a lot of things we were talking about before with regard to limiting social interactions, how we want people to stay home. You may recall last week that we had the Grocers Association and Kathy Sifkin here talking about, make a plan for when you're going to go shopping. Have only one person go. Go once a week. Have a list. Be efficient. Go there and come home. So we want people to think about how can they change what they're doing to be able to limit those social interactions like what we're doing with regard to shopping. We've also seen a number of other people that are doing their part as far as limiting how people are shopping. A lot of the big box stores, for example, in Omaha over the weekend implemented new procedures to be able to limit how many people are going in. Walmart, for example, is limiting 5 people per 1,000 square foot of space that they have in their stores to be able to limit the number of customers going in. They've got one-way traffic going down aisles and things like that, and that's all part of what we want to do to help people limit those social interactions. Another key thing we want to emphasize is that, again, now the entire state is under a directed health measure. On Friday, we rolled out that directive health measure to the rest of the counties that were not already previously covered by a directive health measure. And as part of that directive health measure, it includes things such as ending elective surgeries, making sure that, again, schools are going to be closed or operating without students till May 31st, that restaurants and bars do not have dine-in traffic, again, limiting all those opportunities for social interactions. So we want to continue to emphasize those aspects of it as well. And one very important part of that is that if you have those flu-like symptoms, okay, you've got the cough, shortness of breath, fever, you need to stay home, and everybody in your household needs to stay home. So we want to continue to emphasize that again with this, stay home. If you're sick, stay home, and everybody in your household stay home. So that's part of that as well. And that is how we stay healthy. All those things such as washing your hands often, 20 seconds at a time, keeping yourself 6 feet away. Good job, Lynn. You're farther than 6 feet there. Good job. 6 feet away, making sure we absolutely, you stay out of groups of more than 10 people. That's the 10-person rule. All those things will help us make sure we stay healthy. Also, today, we were talking with, I was on the phone call with Dr. Fauci, who has been representing the administration and talking about the national efforts to combat the spread of coronavirus here in our country. Governor Reynolds and I were both on the same phone call, and he asked me to share that with our conversation, we are on the same page with regard to Dr. Fauci with regard to how the states of Nebraska and Iowa are working to limit the spread of coronavirus here in our state. And we want to continue to focus on that, limiting those social interactions. Now, this is also Public Health Week, and we're going to talk a little bit about this in a little bit more detail here in a second. But it gets back to this point about stay connected and making sure that we're staying connected with our communities while we're trying to stay social distancing. Now, the first thing I want to do as part of Public Health Week is to say thank you to all of our public health workers. They are all working around the clock to be able to keep people safe. They're working very, very hard. We appreciate all their great work. And as a small token of our appreciation, I'm going to be proclaiming it Public Health Week here in Nebraska. And Dr. Antone, I'll ask you to come up and accept this on behalf of our public health workers. Come on up right here, and I'll give it to you right here. So, there you go. Thank you very much, Dr. Antone. I appreciate it.
Thank you.
So, Public Health Week is another great time to emphasize all the other things that can be going on when we have these types of disasters. One of those things is that, again, getting back to this idea, we want people to stay connected. Victims of abuse can become more isolated when we have these types of disasters. We've seen this in the past. In fact, the WHO says that incidence of personal violence goes up in these types of disasters. For example, in 2017 with Hurricane Maria, one of the organizations that provides shelter and assistance saw an increase of 62% to the requests that they got. We see this happening during Hurricane Katrina and Hurricane Floyd in 1999. During Deepwater Horizon, for example, the National Domestic Violence Hotline received a 21% increase in the number of calls coming into it. In New Orleans and Lafayette, they saw their numbers go up by 81% and 116% respectively. So we know that this can happen more often. And so what we want to do is really highlight this stay connected, that we want people to look for those signs of domestic abuse and of violence as victims of this may be trapped at home more. Now, last week, we talked about some of the things with regard to mental health and where people can get those resources. So, for example, we talked about the suicide prevention hotline, which is 1-800-273-TALK. So if you're feeling that mental stress there, please call that for suicide prevention. If you need family help, reach out to the Nebraska Family Help Hotline, which is 1-800-866-8660. Okay, that's an important one to remember. 1-800-866-8660. And if you are one of those folks who may be a victim or need additional help and you need to stay connected, this is a great opportunity to be able to reach out from the Nebraska Coalition to end sexual and domestic violence. We have an organization here in our state to be able to help do that. We've got Lynn Lang, who's the executive director of the Nebraska Coalition to End Domestic Violence or Sexual Abuse and Domestic Violence here in our state. She's going to be talking here in a few minutes about it. You can find out more about that, or if you need resources, go to nebraskacoalition.org, and nebraskacoalition.org, or that national domestic violence hotline is 1-800-799-SAFE. 1-800-799-7233 is another resource to be able, if you have somebody that you know of or you yourself are concerned about being a victim of domestic abuse, stay connected, reach out, ask for that help. That's going to be important for us to make sure that as we go through this emergency here in our state, that we don't see a negative impact on families in another way besides what's going on with the coronavirus. So with that, I'm going to go ahead and turn it over to Lynn Lang, who's the executive director for the Nebraska Coalition to End Sexual Abuse and Domestic Violence here in our state, and have her say a few words. Lynn?
Thank you. Good afternoon. Thank you, Governor Ricketts, for allowing me to join you today and for the focus that you are placing on those who are experiencing domestic violence in our state. The coronavirus continues to affect us all. Many are working from home, facing quarantines, and encountering some level of disruption to their daily activities. For individuals experiencing domestic violence, this public health crisis can expose additional dangers. It's important to note that stress, job loss, and other COVID-19 pressures do not cause abuse. However, those who choose to use violence as a way to control their partner do take advantage of stressful situations to gain even more control. One primary tactic that is used to control victims of domestic violence is isolation, and this is exacerbated under self-isolation and quarantine situations. Victims may be forced to stay at home in a setting that is not safe. Many survivors do not have access to a phone or a computer to reach out for help when they are staying home for extended amounts of time with an abusive partner. Abusive partners may also withhold insurance cards or prevent survivors from seeking medical attention during this time. We want to assure you that domestic violence and sexual assault programs and shelters in Nebraska continue to serve those in need and are committed to helping Nebraskans who are seeking support or are looking for a safe place. Nebraska's domestic violence sexual assault programs and shelters are taking additional precautions at this time to keep survivors safe. They're using shelter options that provide separate bedrooms and bathrooms for each family, and some programs are using hotel rooms or transitional housing apartments. Of course, disinfecting procedures have been increased for all locations. The advocates in each community are doing an amazing job of collaborating with healthcare providers and having conversations with court systems in an effort to ensure that advocacy is still occurring for all survivors. This has included embracing technology as needed for safe and confidential communications. If you do need help during this time, you can find the Domestic Violence Sexual Assault Program nearest you by visiting nebraskacoalition.org/get_help, or if you call the National Domestic Violence Hotline at 1-800-799-7233, it will route you to the program nearest you. Thank you again to Governor Ricketts for drawing attention to this important topic.
Great, thank you very much, Lynn, I appreciate it. Okay, so we just have some other issues I want to hit upon as well, but before I do that, again, I want to just remind people that this is something we can, ending domestic violence or curbing it is something we can all be a part of, especially at this time when we know that victims may be more isolated, to be able to look out for our friends, our family, our neighbors, see who in your church congregation needs help, for example. These are all opportunities for us to be able to take that step and reach out to someone who may need our help, especially when it comes to domestic violence. So with that, I'd like now just to kind of hit upon a couple of other topics that we've had here. One, Blue Cross Blue Shield cost sharing. We had Blue Cross and Blue Shield here earlier talking about how they were going to be reimbursing doctor's visits through telehealth, the same as an in-person doctor visit. They were a leader on that, the first major insurance company in our state to do that. They're being a leader again by talking about their in-network cost sharing has been waived for their members. So what that means is if you're a member of Blue Cross Blue Shield and you're in-network, you will receive that emergency room visit, the care, the testing, everything going along with coronavirus will not cost you any money. That will be covered by your insurance 100%. So again, Blue Cross Blue Shield being a national leader when it comes to that. Second, National Guard. Over the weekend, we had the National Guard assist in testing our young people and the workers at the YRTC in Kearney, and they are now gearing up to redeploy not only in Kearney but into Grand Island to be able to assist with additional testing there. There's been some rumors out there about the National Guard being mobilized and so forth. Those rumors are not true. Please don't spread those things on social media. If you see that, only rely upon the trusted sources like the state of Nebraska to be able to get specific information with regard to what the National Guard is doing. There's no general mobilization. There's no call for military law or martial law or anything like that. So just want to dispel those rumors. Also, despite the fact that we have this emergency going on, the census is still going forward, and we're encouraging everybody to fill out your census forms. Nebraska is actually, last I checked, was one of the number one or number two state with regard to returning census forms. Please continue to return your census forms. 2020.census.gov is a website you can go to. But again, please continue to fill out those census forms while you're staying at home, right? Stay at home, fill out the census form, send it back in. And then finally, I'm going to be on NET again on Thursday night, 8:30 to 9:30 on Speaking of Nebraska. I'll be joined by Tony Goins, who is our Director of Economic Development. We'll be talking about the Small Business Administration. We'll also have Dr. James Lawler from UNMC talking about the coronavirus as well. So should be another interesting program on NET Thursday night, 8:30 to 9:30. Okay, so those are the announcements. And now we'll go ahead and get into the questions and answers here. So, we got a number of questions here, so I'm going to try and get through these as quickly as possible. What are the differences between directed health measures already in place and the stay-at-home orders like ones from Minnesota, California, New York, et cetera? Well, actually, and then how would a stay-at-home order affect the average Nebraskan? Is law enforcement not already supposed to follow up on enforcing direct health measures? So, with regard to the whole idea with regard to directed health measures versus what you're seeing is stay-at-home orders or shelter-in-place orders you may see in other states, they're very, very similar. In fact, in some cases, Nebraska is more restrictive, as I talked about last week in the case of Florida. We have places, for example, where, like in Douglas County, where salons are closed. I actually believe Arizona doesn't close salons as part of their shelter-in-place order or whatever. So you can see that, but there are some differences, and in some cases, Nebraska is being more restrictive. But in general, they're very, very similar, and they accomplish the same ends, which is to really get people to pay attention to stay at home, stay healthy, and stay connected. That's the whole key around these things. We did on Friday, again, roll out our directed health measures for the remaining counties that were not already covered by one. It is a Class 5 misdemeanor to disobey things like the 10-person rule, the not staying home when you're sick, the issues around, again, performing medical procedures that are elective, all those sort of things become Class 5 misdemeanors. But what we really want is for people just to comply. This is really about educating people, about getting their compliance, getting their understanding to do the right thing. We don't have enough police to be able to send them out and enforce this everywhere. What we need is people to comply, understanding this is how we're going to protect the most vulnerable people in our society, in our state. Those people who are older Nebraskans with those underlying health conditions. This is really critical for us to be able to do that. So how would a stay-at-home order affect the average Nebraskan? Well, again, if you go look at some of the orders in other states, you'll see that almost every industry is deemed an essential industry. So just about everybody would stay at work, continuing to do what they're doing here, which is what we want them to do: stay home, stay healthy, stay connected. All right, next. Since meatpacking workers are working shoulder to shoulder in Nebraska packing plants, and states may administer their own job safety and health requirements beyond OSHA regulations, what, if anything, would you direct be done to protect those workers? Well, we're working with the companies directly. For example, yesterday I was on the phone with Tim Shellpepper from JBS talking about the steps they're taking to be able, at their Grand Island plant, to be able to help take care of their teammates there. I've also reached out to a couple of other Grand Island companies today to be able to talk to them about this. We want to make sure that companies are taking all the steps to be able to protect their workers, but also recognize that things like meatpacking plants are essential industries. Even in other states where they have shelter in place or stay-at-home orders, none of these facilities are closed. These are essential for continuing to have a strong food supply chain here in our country. So these facilities are remaining open. Next, will the governor order judges to put a halt to all non-payment eviction hearings prior to March 13th? And is the governor concerned about the public safety aspects of non-payment evictions and hearings? When I put out my executive order with regard to evictions and delaying the hearings on those till after May 31st, you may recall one of the things I said, well, two things. One, for people specifically being impacted by coronavirus, so that's what that's about. But two, that there were also cases where those evictions are part of protecting the public safety. So for example, if there's criminal activity going on, or if you're vandalizing an apartment, those present health and safety issues for the other tenants. So there are cases where those evictions need to go forward in those circumstances. Okay, can COVID-19 be transmitted by mosquitoes from person to person? Actually, we kind of covered this last week when somebody asked about the Red Cross and whether or not they were checking blood to be able to see if that was going to test positive for coronavirus. Coronavirus is a respiratory disease and therefore cannot be transmitted by the blood. And the same thing applies to mosquitoes, that it's not going to be transmitted by mosquitoes like other diseases can, because it's not a blood-borne virus, it's a respiratory virus. Can you highlight the additional safeguards and measures that will be taking place in Grand Island and how your office intends to carry out and implement these measures? Many of you, and Martha, I know you probably did, read the article, you probably got an advanced version of it, the letter from the 45 Grand Island doctors. I had a call with several of those doctors, as well as the Mayor Steele in Grand Island yesterday, as well as Teresa Anderson, who is the public health director. And we talked about some additional steps we can take in Grand Island. I want to thank the doctors and the mayor and the public health official for calling that to my attention with regard to what they're seeing, on the ground there. We are seeing a higher rate of testing positive in Grand Island. And so one of the things the state's going to do to help mobilize resources to address that, actually we've got 5 steps we're doing to help mobilize resources to be able to address that. First of all, we're going to be communicating to employers about the needs for them to follow the social distancing guidelines, specifically around 6-foot distance, 10-person rule, and importantly, if you're sick, stay home, and everybody in your household needs to stay home. If you've got those flu-like symptoms, fever, cough, shortness of breath, you need to stay home. Everybody in your household needs to stay home. That's an important guideline to follow. Second, with the largest employers, I'm going to be working on them with regard to a plan for how they are going to communicate this out and what steps they are taking specifically with regard to their teammates to be able to help protect their health and safety. The third thing is we are going to be gearing up testing. So we're going to be taking the National Guard folks who helped us out to be able to get the YRTC testing done, and they're going to be re-gearing to do additional testing in Kearney and in Grand Island. So we're going to be redeploying some of those resources to be able to get that up and running this week. The fourth thing is that we are going to provide more resources to the Public Health Department in Grand Island to be able to help do their case contact management. So again, it'll help them when they get a case, be able to go out and contact all the other people that that person has been in contact with so that we can get them to quarantine at home. So that's going to be an important step, again, in controlling the spread of this. And then finally, we're going to continue to do more communication, especially thinking about minority communities like the Somali community or the Latino community in Grand Island, to make sure we're getting that message out that, hey, if you're sick, stay home. We know there's concerns about people who are worried about maybe losing their paycheck if they don't show up sick. One of the things I've asked employers to do is make sure their teammates know that what the policy is about calling in sick for work and what circumstances they can stay home and still get paid and all that sort of good stuff. So we're going to do more around communication and get that word out in Grand Island about, again, the importance of following all of our social distancing guidelines. Stay home, stay healthy, stay connected. We want to make sure that they understand what that means with regard to the 10-person rule, the 6-foot distance, washing your hands often, don't touch your face, all of that. We're going to do a better job of communicating specifically in Grand Island. So Tyson Hervanik, who gave me that from KRGI, you can expect that I'll be following up with you specifically. And then we also got another question. These are from Steve White, also with NTV. Does testing in Grand Island expand testing guidelines? Will we be hearing the testing at specific workplaces? Around testing, again, we're going to be working with Teresa Anderson, the local public health department person there, on what that additional testing will look like as we get to help us get a better picture of what's exactly going on in Grand Island. Are there National Guard resources that could be used to set up screening areas? Again, the National Guard helped us out with the YRTC. They're going to be helping out in Grand Island as well, doing that testing. And then finally, a second hospital that will open soon in Grand Island. Can the state fast-track licensing for Medicaid certification to get the facility open sooner, if it can be of assistance? Again, this is a federal issue with regard to getting them open with regard to Medicaid, but I directed Dr. Antone to work with CMS to see if there is a possibility of fast-tracking that and what would all be involved with that. So thanks for the question, Steve. We'll work that issue, but I can't give you an answer specifically whether or not the federal government will be able to fast-track that. Taylor.
Okay, we have several questions. Don Walton has a question. He said,
Don Walton already asked a question. What, you got second thoughts now? Oh, okay, fair enough.
Could you give us more detail about your conversation with Dr. Fauci?
More detail about the conversation with Dr. Fauci. So Governor Reynolds and I got on the phone at noon with Dr. Fauci. We talked to him about the stay-at-home, shelter-at-home things that he's been talking about on TV and what we've been doing in our respective states with regard to how we're combating the coronavirus. And that we were concerned that his message was somehow getting confused with what we were doing, and we described what we were doing, and that's where he said, hey, you can let people know we're all on the same page with regard to what we're doing in our states and what his message is about. And it really is about, again, stay home, stay healthy, stay connected. He wants people to be able to, again, limit their social interactions. That's what we've been preaching as well. And I just want to share with you, again, some of the facts that are out there about what we here in Nebraska have done. And really, again, folks, these are a lot of local people making great decisions about what they want to do. So, for example, when we had our first person get identified with coronavirus here in our state, that was March 6th. Mark Shepard, the Fremont superintendent, made the decision over that weekend, because that person had been in Fremont, to go to spring break early, starting March 9th. So he basically closed his schools March 9th and started spring break early, 3 days early. So, and actually Loganview and Plattsmouth also followed suit. So what you see there is, again, somebody taking proactive steps. The schools in New York didn't close until March 15th. So Nebraska schools started closing earlier, and you may recall that on March 13th, we had a press conference right here with Dr. Cheryl Logan, talking about how OPS was going to just extend their spring break and not come back the following week. And I was here supporting that, as well as Lincoln Public Schools doing the same thing. So again, effectively, Lincoln Public Schools and Omaha Public Schools, two of our biggest school districts, were effectively operating without students starting on March 7th. So again, much earlier than what was happening in some other states. You may also recall we had the state basketball tournament here, operated with families only, right? That was March 12th. March 12th was also the day that I believe Broadway finally closed down. And when, you may also recall the incident with the Creighton St. John's game, I think it was St. John's, right? that was the Big East tournament was going forward in New York. I remember telling my parents that they had to stay home, they couldn't go to that, that got canceled at halftime. So again, what you saw was Nebraskans taking proactive steps to be able, common sense stuff with the things they were responsible for to be able to work the issues. So that's part of what we described to Dr. Fauci with regard to things we were doing here in Nebraska. Kim Reynolds described what they were doing in Iowa, and that's where Dr. Fauci came back and said, hey, tell everybody we're on the same page.
Kelsey with NET, I'm sorry, has two questions. One is, since last week, is there anything additional that's been done to supply areas outside of Lincoln, Omaha with additional equipment or supplies since last week?
Yep, so I don't have any new updates for you, other than to say that when we got our stockpiles out of the National Strategic Stockpile, we did distribute that out to all the local public health districts, so that got distributed entirely across the state. And we're working to procure more PPE, and we'll distribute that out as it's available. And again, through those local public health departments. One of the things we did actually a week and a half ago now is we asked those public health departments to submit their needs to us to help inform some of our buying going forward.
She also asked, what steps have been taken to train EMT units across the state so they're able to safely transport patients who may have COVID-19?
So the question was about, again, what steps have been taken to train EMT units so they can safely transport COVID-19 patients? And Dr. Antone, I'm going to turn that one over to you to field that one for the specifics you may know about.
So our major transporter, Midwest Medical, is like probably the world's leader in knowing how to do personal protective equipment and transporting patients because of their experience that they had with the repatriates early on when the repatriates from China came back, and then the Crown Princess and the Diamond Princess came back, so they have extensive experience. The other EMS providers have also been trained in proper PPE precautions when transporting patients. And we'll be relying on that too, because we'll be having them transport patients to these facilities that we'll be designating as convalescent sites after patients get well enough to leave the hospital and then go to our convalescent sites. If I could also just take this time to also thank all our public health workers too, specifically in our Department of Health and Human Services. They've been working extremely hard, but then especially to thank our 19 local public health departments here in the state. When people ask how and why Nebraska might be doing as well as we're doing, I attribute almost a lot of that to our local public health departments and their directors and their staff. So again, just thank them for all their work. Pretty much everybody's been working around the clock, 7 days a week for almost exactly a month now. So I can't thank them enough, so.
Great, thank you, Dr. Antone.
Rick Ruggles from the Omaha World Herald is asking, is a shelter-in-place order coming and what exceptions would that include?
So the question was, is a shelter-in-place order coming and what exceptions would that include? Again, we've kind of covered this already with regard to our plan, going back to what we put together now about a month ago or so. Doesn't have that. Obviously, we'll continue to reevaluate the data, and the data so far seems to indicate that our plan that we put in place is working. However, we are going to look at data like we're looking in Grand Island, and we'll make any changes as needed.
Back with NET wants to know if we have any additional information about whether cities or counties can declare their own stay-at-home order or DHM.
So the question was, can cities or counties declare their own DHM? Cities cannot. That is not in the purview of cities. Public health departments can, but they also have to get it checked off with the state.
Rob McCartney wants to know if we're reconsidering a decision to move or to not move the primary election in light of other states that may be doing things.
So the question was, are we reconsidering our decision to have the primary May 12th? And no, we are moving forward with May 12th as our primary date. However, what we are doing is encouraging people to fill out your early voting ballot request form that you all received in the mail. It was mailed out to everybody. My house, I got not only mine, I saw my kids had theirs. So we're encouraging everybody to fill those out, turn those in. You can vote by mail. You can drop it off in a drop box. We're really encouraging people to fill those out. And I think we've had actually great uptake on that. I don't have the numbers off the top of my head, but I know a lot of people have been filling those out. We continue to urge you to do that. The deadline is May 1st, so you've got a lot of time to be able to fill those out and get it in.
Don Walton has a follow-up. He says, how do you apply the 6-foot rule to the workplace, including manufacturing
So the question from Don Walton was, how do you apply the 6-foot rule to manufacturers like meat processing and so forth? Again, folks, the 6-foot rule is about how we social distance ourselves. We understand there's businesses that their jobs are such that they cannot stay outside of 6 feet to perform their job duties. That's okay. If your job requires you to be within 6 feet of somebody, that's okay. What we want people to do is take proper precautions to be able to make sure they're keeping people as safe as possible in those circumstances. Again, things like the meatpacking industry are essential industries to keeping our food supply chain going. I've talked to the folks specifically at JBS about what they're doing to help keep their teammates safe. So we understand that if you're within the 6 feet, it's okay if you're doing it for business purpose. The 6-foot rule is really about trying to, just kind of Lynn was way over there early at the press conference. There was no need for her and I to be closer than 6 foot because that's not what it would take to do our jobs.
Aaron Duffy with the Omaha World Herald wants to know if we have any additional detail about testing supplies, number of guard members, or et cetera, about our plan for Grand Island at this time.
So the question was, do we have any additional details with regard to our plan with regard to Grand Island? No, those details are being worked out today, so I don't have any additional details. Remember, this was something that we discussed with the mayor of Grand Island and the public health officials and so forth yesterday in Grand Island. That was a Sunday, even though our public health officials are working on the weekends too. We didn't get around to planning that until we finished up what we were doing at the YRTC and then rolled into doing that planning starting today for a rollout later this week.
Tara Campbell has a follow-up question. She wants to know if you're concerned about the safety of people going into courtrooms and whether that's potentially going to spread the virus.
So the question was, are we worried about the safety of people going into courtrooms? Will that potentially spread the virus? And again, what we're asking, we understand there are business need that needs to go on. And so we're asking businesses, including the courts, to be able to take those steps. But here's the deal, folks. Chief Hevekin wrote the book, the pandemic bench book, in 2018, well in advance of this. In fact, it's being used by other states. That's how good it is. So the courts have been prepared for how to operate under a pandemic for 2 years already, since Chief Hevekin put this together. He was prescient in his ability to see that there was going to be a need and get prepared for it. In fact, we've been relying a lot in our governor's office as well. So again, we expect the courts to take the same sort of steps that meat packers or anybody else would have to take to work to keep people safe, and they're doing that. In fact, we've written the book. Chief Hevekin literally wrote the book.
So about the moment.
All right, great. Other questions? Martha?
When you talk about the 6-foot rule, and you say that it doesn't apply, you know, that there's businesses and you have to keep going with those businesses, but the 6-foot rule is there for health reasons, and so if you're not maintaining that distance, isn't there a risk? Even if you're doing it for what's gonna
So the question was, hey, if you're inside that 6-foot rule, isn't there a risk that you could spread the virus? Well, there's always going to be a risk if you leave your home. Unless you completely isolate yourself from every other single human being and stay in your home, you will be at risk. What we're asking people to do is mitigate the risk, minimize the risk. That's what the whole stay home, stay healthy, stay connected is about. We want people to take the common sense steps to be able to protect themselves. And again, by implementing those things, and especially things like the 10-person rule, staying out of large groups, because that's how the virus spreads more quickly, that's how we slow the spread of the virus. So again, we want people to use this common sense, good judgment, be able to do the things they can do to take the common sense steps to be able to protect themselves and others with regard to how you slow down the spread of this virus. Yeah, Andrew.
Governor, have you seen the pandemic plan outbreak, for both YRTCs and for corrections? We're hearing that a lot of other people are having a hard time viewing these particular plans, and should those be public? And why should they be kept secret?
So the question was with regard to the pandemic plans for things like the YRTC and for corrections, and have I reviewed them personally? I actually have not reviewed them personally. We've got people like Scott Frakes and Danette Smith who are overseeing those areas to be able to manage those sort of things. And, they are, part of what they're doing is their day-to-day jobs. And with regard to the public nature of those, having not seen them, I can't tell you specifically, but I can tell you that, again, when you're talking about sensitive areas, like how do we keep our young people safe and how do we keep our corrections officers safe, there may be sensitive information there we just don't want out there in the public in general.
But have they requested
So at a high level, yes. So, I mean, at a high level, they're both making plans for how they isolate people who are identified with coronavirus, taking steps like we announced on Friday with regard to our corrections workers all wearing masks and that sort of thing. So they are implementing steps to be able to help keep the people they're caring for safe and have, plans in place for if their own workers become ill. In fact, I can't remember the exact date, but we had a conversation with this probably a month ago with my team with regard to everybody doing their continuity of operations planning. And corrections had a plan long before this all came up because that's just part of how we operate. So all those plans were in place. We asked them to update it about a month ago. And that's part of, again, how do you make sure you manage to make sure you've got the staffing to be able to help do it. And one of the things I will continue to say is that corrections is hiring. And in fact, I know that we are seeing people apply, so we're actually reducing the number of vacancies we have.
But you had a case that tested positive in the pen, and they were isolated for 10 days. How much did you isolate some of those other people or inmates, in that time period? And then, I guess after the YRTC happened, you brought in quickly, the National Guard to help out test everybody. Why wasn't that done, or why isn't that being done at the penitentiary?
Well, again, it's about how many people do you have access to, right? And so, again, when you're talking about corrections where by nature the people are going to be easily isolated and not have contact with a lot of people, it's probably easier to run all those things down versus maybe the YRTC. So every institution is going to be different based upon the mobility patterns of the residents and of the workers. So again, Director Frakes is doing the right thing for corrections, and Dennis Smith is doing the right things for YRTC. John?
Governor Reynolds today made more restrictions, closing some non-essential businesses, libraries, things of that nature. I know you are not really wanting to do a stay-at-home order, but are you considering restricting more businesses today?
Yeah, as I said before, we've got a plan. It's our plan assumed that we will not have robust testing, and we're seeing that the testing we are doing seems to be that we're slowing the spread of the virus. But as we get new data, we'll reevaluate that. So we could do more restrictions in the future based upon different data that we got right now. So trust me, we're watching this data daily, if not hourly, with regard to how many cases we're getting, how many people are testing positive, that sort of thing. So we are constantly reevaluating that. If we need to do more, we'll do more. And in fact, Grand Island's a great example of how we're doing more, right? So after hearing from the folks specifically there with regard to what they were seeing, looking at some of our own test data, we decided to move in additional resources to be able to address what's going on in Grand Island.
Governor, it sounds
Yeah.
like a lot of people, we've heard several people say that Nebraska needs to be in stay-at-home order, but just looking on paper, like compared to other stay-at-home orders in other states, Nebraska is pretty much like similar to that, if not having more restrictions. So where do you think the disconnect is for people for what Nebraska is doing to make sure that people stay safe?
Well, again, what we're doing here in Nebraska is very similar to what other states with the so-called shelter-in-place or stay-at-home orders are. And so part of it's just semantics. Again, part of what we're seeing here is that Nebraskans are doing the right thing. Now, we certainly want to continue to do more. We want people to stay home, stay healthy, stay connected. Okay. Notice the new slogan, right? So we want to make sure people are doing more. We want to emphasize that. But as we look at, and we'll continue to reevaluate the data, but as we look at the data, we are seeing that we are different from other states that maybe didn't have as much advance warning, that didn't take the steps we took. And so we've seen a slower spread here than maybe other places. Yeah.
On the call earlier with Dr. Fauci, did you guys mention or talk about how Nebraska compares to maybe some of the other states that have been dealing with this, obviously? And also, did you talk about what some of the good and bad that Nebraska has done that you'd like to see improved upon, or things that have been done beyond expectations?
Yeah, so the question was, did we talk about some of the things we've done specifically here in Nebraska, and did Dr. Fauci have any feedback for us? So we did talk about some of those specifics. Again, like some of the dates I gave you comparing what happened here in Nebraska versus what happened in New York, and how our responses were relatively the same, yet we know New York had a lot more virus at that time than Nebraska did. Dr. Fauci did not have any specific feedback for us on additional steps we need to take.
And any comparisons maybe to any other states? How would you feel?
Nope, Dr. Fauci didn't compare us to other states. What he said was, hey, we're all on the same page. Yeah, Martha.
When Dr. Fauci was telling you that you're all on the same page, was he saying that he was walking back what he had said earlier about all states need to have a shelter-in-place order?
So what Dr. Fauci said is he did not mean that to override our ability as states to be able to manage our states. In fact, he specifically said that he believes states should be able to manage the emergency on what they think is best. So he didn't say he was walking anything back, but he certainly said, hey, you and your states need to do it. I certainly did not, he said, I did not mean that to be a criticism. You know, you all are taking the same steps as when we described what Iowa was doing, what Nebraska was doing. He said, hey, we're all on the same page. You're taking the steps to be able to slow the spread of the virus.
Did he say that he would recommend that you have a shelter-in-place order?
Dr. Fauci did not recommend that we go to shelter in place or stay at home. Go ahead, Martha, go ahead. I'm sorry.
I mean,
Dr. Fauci did not mention that at all. Yeah, Andrew.
Governor, I don't know how many in Omaha, how many tickets have been written. I know Lancaster County, no tickets have been written. And Grand Island, I think one ticket has been written for violation of the,
DHM.
DHM. I mean, at what point do local authorities have to start writing tickets?
So the question was, very few tickets have been written along these lines. And I think that goes back to really what this is about communication and getting people to comply voluntarily. So for example, let's take Illinois' shelter at home order or shelter in place order. If you read through that order, what you'll see at the end says, law enforcement may enforce this. It may enforce these rules. It doesn't say they shall, which means that they've got the option to do it. So even Illinois, with their shelter at home order, recognizes that law enforcement has to use its best judgment. And I think that's what we want people to do, is use good judgment, use common sense. You know, when we have reached out to businesses, and the mayor of Omaha has done a great job of reaching out to, for example, the big box stores, they took action, right? I know the Omaha police were going around to visit the big box stores this weekend. I sent my state patrol around to go visit the big box stores. They looked and they made actions. They took steps to be able to limit the number of people coming in, to spread them out. So we saw that when you talk to somebody and you open up that good line of communication, people take action. We're going to take the same approach in Grand Island. Talk to the businesses, really ask them for their plans for how they're going to, you know, especially the large employers, what they're going to do with regard to protecting their teammates. But when we've asked for people to do it, they've done it. And that's one of the reasons why I think that we see a slower spread here than maybe in other states, because we had more advanced warning, and Nebraskans are by and large following the stay home, stay healthy, stay connected, rules and the social distancing to be able to do that. What this really needs is every Nebraskan to participate. We don't have enough police to force every Nebraskan to participate. What we need is Nebraskans to understand why they need to do this, why it's going to protect people in our communities, and when you explain it, generally they do.
I guess you're getting a lot of frustration from people, though. They call in complaints and they still see people continue to do this stuff.
Well, again, communication, the question was, we see people who are frustrated because they call in complaints, and some people still are not following the guidelines. I would say my experience is really kind of the opposite. That when we see people call in, and when we call in and say, hey, will you please make changes, they have been making changes. Yeah.
I want to ask you about, like, on Albert Park. We saw in the data that a lot more Nebraskans are going to these types of places, and I know Mayor Stothard has had concerns, like Sorensky, she's considering shutting it down because it's been getting so busy. Would you recommend Nebraskans go to these parks sometimes, or should they scale that back as well?
Well, when it comes to going to parks, we want people to go outside and get exercise, get some sunshine. It was a nice day yesterday. I went out for a walk with my wife. If you want to go to a park, though, you got to remember the same sort of rules we've been talking about, though. So don't go play team sports in a park, okay? So don't go play volleyball where you're going to be in close contact with other people more than 10. Stay 6 feet distance from other people in the park. Make sure you're doing all the other things with regard to don't touch your face, cover your mouth when you cough. Make sure that when you go home, you wash your hands really good with soap and water for 20 seconds. I mean, all the common sense hygiene stuff we're talking about. If you go to the park, please do that. And if it becomes a problem, then some of our mayors will take action. As Mayor Stothard may take action on some of her parks. If she sees that it's becoming a problem, that too many people are gathering in big groups, she may take steps to be able to close that park so that we don't see those big groups of people gathering. So if you go to the park, you want to keep it open, make sure that you keep that social distancing, no big groups.
Governor, I guess
Yeah.
for me, I just want to know like the main difference between a directive health measure and a stay-at-home order.
Well, the directive health measure is actually enforceable by law. It's a misdemeanor violation. Depending on how those stay-at-home orders are written, they're executive orders, they may or may not be enforceable by law. And I can't tell you, for example, I use the example of Illinois. I don't know what the laws of Illinois are. It did not say it in their executive order what the penalty was. It just said that law enforcement may not even enforce any of it. So I guess the point is, that we really need that voluntary compliance. We need people to do this. Directive health measures have the force of law. They absolutely have the force of law. You can get that ticket, but that's not what we're trying to do. We're trying to get people to voluntarily comply.
We have time for a couple more questions.
2 more questions, yeah.
What was the tipping point on Friday for you to go with the direct health measure for the entire state? And what was that conversation like? Did you see a rise in data, or was it just like, what was the decision?
So the question was, on Friday when we did our directed health measure that included the rest of the counties in the state, what was kind of the tipping point to be able to do that? We had a community spread case in Gage County, and given the population base with Beatrice and Gage County, we made the decision that so much of the state's population was being covered by this to be able to really communicate out and cover the counties that weren't being covered already, and just really as an ease of implementation, we decided to just go ahead and do it for the entire state so that people would have very clear guidelines of what the expectations going forward would be.
Your big concern in doing that was that people would then get lackadaisical. Is that still a concern that the state will have that problem?
Yeah, it is still a concern that if we, if we go too early in some places, that people will get tired of that. But again, this is where we're just gonna have to continue to do that education of letting people know what's going on and continue to watch the data to see what's happening in other parts of the state. Again, as we rolled out restrictions, as we saw the virus spread, we didn't do it at the same rate at the same time. We may roll back restrictions the same way. Some parts of the state may get rolled back sooner if the data demonstrates, before other parts of the state, just depending on how well they are at controlling the spread of the virus. And so again, just go back to saying some of the things like with Coach Cook. You want to see football this fall? Stay home. If you're a high schooler, it's kind of graduation plan for August, you want to go to that graduation ceremony? Stay home. Martha?
So, given this new slogan and this emphasis on staying home, which was it's not part of your directed health measures, is this kind of a voluntary stay-at-home kind of measure, the way you started out the social distancing as a voluntary kind of guideline?
Well, the emphasis, remember last week when I showed you the Google data, it showed that staying home was only up 8%, and I said, hey, we got to do better. So this is part of our efforts to say, hey, we got to do better, right? Stay home, stay healthy, stay connected. So this is part of our, after seeing the Google data, we're like, hey, we did great in some areas, like 34% reduction going into retail and entertainment venues, but only 8% up on at home. So let's do better at home. Let's stay home.
Time for a final question.
Last question. Yeah.
I guess just for Nebraska, we're talking about this, a lot of people are stressed right now. What, as governor, what would you say to these people to kind of give them hope through this time?
Yeah, folks, there's no doubt that April is going to be a tough month. We've been saying that for a couple of weeks now. This is going to be a tough month. But we will get through this. We will get through this like Nebraskans, by working together. So please, follow the guidelines. Stay home, stay healthy, stay connected. Practice all those social distancing guidelines, and that will help make sure we protect the most vulnerable people in our community and that we don't overwhelm our healthcare systems. So what we are doing is working. When we look at the data, we are seeing that while the number of cases being reported is going up, it's not going up as fast as what has happened in other states. Now, we got to continue to stay on top of this, and we will take other actions if we need to. But right now, we just got to continue to stay focused on those social distancing guidelines and make sure we get everybody, every Nebraskan has an opportunity to be able to participate and be able to help slow the spread of the virus by staying home, staying healthy, and staying connected. All right, folks, thanks again. Appreciate it. You all have a great afternoon. We'll see you back here tomorrow at 2 o'clock. Thank you, Lynn. Appreciate your participation today, too. Thanks.